Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator here with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm very good, thank you.
Dr. Murphy is the executive director of the Havey Institute for Global Health, as well as the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines through today, September 28th. And as always, we invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Again, you can find those links in the description. Starting with US COVID statistics, average new hospitalizations per day are 2,810. Average COVID deaths per day are 87.8, and the new booster proportion is 17%. We'll have some notes on the other new COVID boosters soon, but Dr. Murphy, your reactions to those numbers.
Yeah, so the new hospitals, we're not counting cases any longer. That's long gone. So there's no point reporting them. There's nothing to report. But the hospitalization number and the death number are solid numbers and easy to follow. So the COVID hospitalization admission has tripled in the last 2 months. So definitely going in the wrong direction. It's still 6 or 7 times less than what it was at the height of the pandemic, so that's good. But I mean, it's going in the wrong direction. And you can see the mortality rate is now 87.8 cases per day. Remember, just a couple of weeks ago, we were at 25. So this also has tripled. Now remember, you get infection, you get sick, you get very sick, you end up in the hospital, maybe the ICU, you die. It goes in that chain like that. So the death rate and the hospitalization rate are downstream from the case rate. So they're not going in the right direction. So a couple interesting points here is that more than half of the new COVID hospitalizations were people 70 years of age and older. 2/3 were above 60. And very disturbing news from the American Academy of Pediatrics showed that COVID hospitalizations among children were rising much faster than average. And this is typically kids under 5. If the week of September 9th, 1,200 children were admitted to the hospital because of COVID, nearly 5-fold increase in the last 3 months. So this is really bad. Whenever you see a kid who's got a respiratory infection that has to end up in the hospital, it's a really scary thing. And it just goes to show you how important it is that we keep up with the vaccinations. I mean, they're getting vaccinated for everything else. We should vaccinate them for COVID too. Keep them out of the hospital as well. It's very important. Young kids and older people, that's the one that kills the flu, kills them. And we give the flu shot right away. We should be given this COVID vaccine. And the COVID vaccine, the new vaccine, it's not a booster now. It's a new vaccine, brand new for Omicron. The variants that are floating around now is approved for everybody 6 months of age and older. So we got to put that, put that in the box there and really strongly consider it. Now, if you look around the country, interestingly, the highest hospitalization rate from COVID, which is our really good marker, is in Florida. And there should be no surprise there because the public health department in Florida don't believe in vaccines. They don't, they're not, matter of fact, they're working against the whole vaccine. They're making it difficult to get the vaccines, which is strange because Florida has an interesting mix of a lot of older people and they have a lot of young workers there with kids. So they've got a very high risk group, and that's why they've got the highest hospitalization rate now. But following Florida is Washington, D.C. What's the story there? And then Arkansas, Alabama, Louisiana, and West Virginia, there should be no surprise. But the DC, there's something else going on in DC, the inequality in the medical care, the underserved populations, don't know. That has to really be investigated further. So COVID's everywhere. It's going to be more in places that are sort of in the anti-vaccine category.
Absolutely. And following that up, due to the uptick, I know we talked about it a little bit last week, but an important announcement that started this week is that there are now free tests being given out once again. Can you let us know how to go about getting those?
Yeah, covidtest.gov. I think it's the old website that was distributing these things. People can get 4 free test kits per household in the mail. You just sign up and they just send them to you for free. The plan went into action on September 25th. And as we see it, these uptick in hospitalizations, that means there's a lot of COVID floating around out there now. As I mentioned, I supposedly, and you too, because we work for the same institution, Northwestern University, I always elect to take the high-end Blue Cross Blue Shield, medical insurance. They don't pay for outpatient tests. And I was at a wedding a couple weeks ago, and the bride gets COVID. So I ran out and bought some tests. The insurance didn't pick it up. And they said, oh, no. I actually called them. I said, this has got to be a mistake. Nope. And they said, the person's going, oh, now, Dr. Murphy, the COVID pandemic is over. So that was the response I got. Anyway, so you can get your free tests now, at least 4 of them. And that will help a little bit. If you want to control a pandemic, you got to test the people that are at risk and get them out of the system so that they stop spreading it. This is a highly contagious virus.
Absolutely. And speaking about the lingering effects of the pandemic that we're still seeing today, moving into our first headline, there was data from the CDC released on the number of US adults who have struggled or are currently struggling from long COVID. Can you tell us a little bit about the data the CDC released?
Well, everyone's heard about long COVID for years, and now it's really being studied very carefully. And so it's showing that in the United States, about 7%, 18 million people, adults anyway, of the US are reporting symptoms of long COVID. Right now, they've reported that. And so a lot of people get better. So if you just look right now, it's 3.4%. So, long COVID can't go away. Who's at risk? Women are a little bit higher than men. But the interesting thing about who's getting long COVID is actually the younger people. So the people that weren't so sick with COVID, didn't end up in the hospital, ages 35 to 49 is the most likely age group, although any age can get it. But it's almost half as less in the older population. They ended up being a little tougher, but these younger people have it, and it's devastating. And so it's just another reason why the new vaccine that's out is recommended for everybody 6 months of age and older, no matter what age you are, because the vaccine not only protects you somewhat from COVID, but it protects you a lot from severe disease, death, and long COVID. So, that's why you want to get it. The other thing that they found was that you would think that in the cities where people are close together and taking the subway together and buses and, lots of people and places, that's not the place where they have the highest incidence. It's mostly in the non-metropolitan, which means rural areas. So, people congregate no matter where they live. And in those rural areas where typically they have less vaccine coverage, and that's what they think is the reason for it. That's just of interest. So it's not just an urban disease is the main point.
Absolutely. And kind of segueing into another long COVID story, there was very, very interesting research just released about a possible blood test to identify or diagnose long COVID. Could you tell us a little bit about that?
Yeah, this is part of the research into long COVID, not only just reporting the numbers, but like what is going on with these people? Okay, number one, it's real. It is totally real. And what they're finding in this one study that looked at 215 people and really studied them very carefully, that the immune system is very much affected. Similar to, other viral diseases where your immunity goes down when you have the viral disease, not just HIV, but like almost every viral disease. But anyhow, of these 250, they had a significantly lowered level of cortisol. It's the hormone. It's responsible for, your get up and go energy level. That these levels in these people that had symptoms in long COVID were half that as what was expected. So this is a very real finding. Now, if someone is feeling fine, you don't go out and do a cortisol level. But if somebody comes in with long COVID and, their brain fog or whatever it is, the issue, you would expect to find a high chance of having very low cortisol. Now, what does that mean? You can give cortisol to a person, but that's not the problem. The problem is what's causing that low cortisol. So it's not like replacement therapy is going to make you feel better. Matter of fact, it could make you worse. So, but it is a marker that could confirm, that yes, your symptoms. This is not something else. This is long COVID.
Well, that's very, very interesting. And we, of course, will be keeping an eye out for any follow-up studies or just
Yeah,
general long COVID studies.
you'll be hearing a lot more about this and other
Absolutely.
markers. Well,
Well, very, very big news. And moving on to the new vaccine that we've talked a little bit about, there was a report that approximately half of US adults are planning on getting the new COVID-19 vaccine. Can you tell us a little bit about where that data comes from? And I mean, if that's really true.
Yeah, this is from CIDREP. I think it's the group at the University of Minnesota. I'm pretty sure. I saw this report this morning. So, and these surveys that go out show that the typical number of people are planning to get the flu shot and the RSV shot and the COVID shot. So the highest group is the older people over 65 or 70. They don't want to get sick and they're nervous. So that, over 75% of them typically take it and they give it routinely in nursing homes, like working at a hospital. Like I have to have it by, I think, December 1st, or I can't even walk in the door. But that's flu. And people are used to that. You're either going to take it or not, but it's a pretty high number. But the COVID vaccine numbers are really low. So people were waiting for this new one to come out, which is now out. And it's only 46%. It's like half that of the flu. And this is really unfortunate because the old vaccine doesn't work too good with what's going on now. And that's why there's so much COVID going around. And that's why the hospitalization rate is going up. And that's why the death rate is going up. So, yeah, that's a disturbing number. We have to really work on that. I mean, the COVID vaccine, over 18 million, 18 billion doses have been giving them vaccines around the world. If this had any kind of like weird long-term side effect, even in 1 in a million, we would really know it. It's a very safe product, and don't listen to anyone who says differently without seeing some real hard data. So, but anyway, yeah, that's disturbing because that's going to mean that the COVID endemic is going to, continue percolating along, and it's going to impact people negatively from public health.
Yeah, so please, people, look out for those vaccines if they're available around you. They should be. But switching gears, we talked a little bit about RSV and flu there. There was another interesting study released in Respiratory Medicine about RSV in adults and the comparison of that to influenza A. Can you tell us about what that study found?
So I think people are more familiar with influenza, and it's mostly influenza A, and we know that it's a nasty disease. And an Italian study in 717 people seen in an emergency room that came in with flu-like symptoms. 14% had influenza A, 8.6% had COVID and 8.5% had RSV. So there's a lot of RSV out there. And if you look at the RSV patients coming in with a respiratory complaint, they had the highest occurrence of respiratory failure. That means they got to get in the hospital, get on oxygen or intubated or whatever. That was 62.7% with severe disease. And that was really the worst compared to the influenza A. So the mortality was relatively similar, 6.6 versus 5.9%, not statistically significant. But it just shows you that RSV is a very severe and it's a more commonly severe respiratory disease. So as we've mentioned, and what people have probably been seeing on television now, are commercials for the RSV vaccine. It's approved for people 60 years of age and older, or people who have underlying immunocompromised condition, organ transplant, something kind of severe. They are approved for RSV vaccine. My patients have started to go get it. Nobody has complained of any kind of significant side effect from the vaccine so far. I mean, a very small sample size, but in the studies that were done and got the vaccine approved, the side effect profile was just like a typical any kind of vaccine. You get a little sore, at the arm, and maybe a little achiness for a day, and then it's gone. But this study just tells you how important RSV really is. We didn't used to test for RSV, so people used to get sick. They used to get pneumonia. We used to say, "Oh, you have viral pneumonia." We didn't even test for RSV. Now it's very easy to test for, so that's why we're seeing it.
Absolutely. And lastly, moving more into the flu category, our last headline for today, there was a very interesting study, lots of interesting ones this week, where 1 in 6 US patients hospitalized with a couple of different flu strains had more severe outcomes. Can you tell us about the differences in these flu strains and which one seems to have the most severe outcome?
Yeah, so we all know that the H1N1 is a real severe flu, and that's influenza A, but also influenza B, which is less common. So if you had H1N1 or you had influenza B, 1 in 6 people infected with either one of those ended up with severe outcomes, like a hospital admission or an ICU admission or death if you lump them all together. So, and this used this influenza hospitalization surveillance network that's been set up for a while to follow flu, to assess flu outcomes in over 100,000 people over 6 months who were hospitalized in 13 states. And they compare like different years to another year because there's different strains of flu floating around in each of those years. And they found that those 2 strains were the worst. And it's just more information about flu and just more reasons why you want to keep up with your flu vaccines, which change every year. So every year you get a different flu vaccine. They make it based on what's going on in the Southern Hemisphere in the season before, and they guess what is going to be floating around in our hemisphere. And that's how we do the flu. And you can take the flu vaccine and the COVID vaccine at the same time. You can split it up. Doesn't really make any difference, but they are approved to be given at the same time if that's more convenient for you.
Absolutely. And those are really important things to keep in mind as we enter into not only the flu season, but this COVID season that's coming up this winter. Keep an eye out for those vaccines around you. I'd really like to thank you, Dr. Murphy, for your time and expertise breaking down these headlines for us and, giving us the scientific explanations. So thank you.
Well, thank you, Katie.
And everyone who is watching, thank you very much for continuing to watch our show. We appreciate it. And we, again, welcome you to submit any questions you have down below via Facebook or via email. Have a great day, everyone.